I'm Leanna Ben, and I'm here today to talk about and update you on the Healthy Youth Act. So I'm going to give you a little history, and then I'm going to give you some recommendations. So let me start with the history of the Healthy Youth Act. It was passed in 2007. It gave schools the option to teach or not sex education. If schools chose to teach sex education, they had to follow the exact philosophy of the OSPI. Many schools did not choose to do that. It also gave parents the right to opt their children out of the program, but it also required the Superintendent of Public Instruction, OSPI, to report to the state legislature what was being taught in which curriculum. And they were supposed to start doing that in 2008, 2009. The findings in that legislative intent for 2007 was that the legislature wanted young people to have skills and knowledge to protect themselves and to build healthy relationships. And the sentence says the primary responsibility for sexual health education is with parents and guardians. And so that's an important piece that the legislature passed that is in current law. And then they established in the legislature that the OSPI would follow the 2005 guidelines that were written, even though it was passed in 2007, implemented in 2008. They were to follow the 2005 guidelines, which are much less explicit than the current learning objectives on the OSPI website. Fast forward, 2019, the legislature had more than 5,000 citizens that physically went to Olympia to oppose Senate Bill 5395 that was to mandate sex education for all public schools K-12. It passed out of committee in the Senate, and it went to the Senate floor, and it passed out of there, which meant that it went to the House because it went through both committees. But it was not sent to the floor of the House probably because 5,000 citizens and uncounted thousands of emails and letters to the state legislators. So they didn't pass it out. They held it over for the next upcoming legislature in 2020. But the budget approved for 2019 gave $200,000 to do a study so that they would be ready to pass the bill in 2020 that mandates all sex education K-12. They did a study. The study just came out, and in reading the study, you'll find that it says the results of the study do not warrant passage of mandatory sex education in schools. And let me quote it. Overall, since there is limited data, the Health Impact Review of ESSB 5395 cannot estimate the potential magnitude of impact on health outcomes, including changes in the rate of STIs and teen pregnancy. That's on page 11. But let's look at what we're supposed to be doing in RCW 28A. That was the Healthy Youth Act. And it said that based on medical accuracy, they were supposed to be reporting, but number 7 in that law says, the Office of Superintendent of Public Instruction shall ask public schools to identify any curricula used to provide sexual health education and shall report the results of this inquiry to the legislature on a biennial basis beginning in 2008 and 9 school year. That is not a typo. That has not been done. This last school year, I sent a couple of requests for public information requests, and they came back saying that they don't know who's teaching what. And this report also shows that the Superintendent of Public Instruction does not know who's teaching what. So I have a solution. Solutions are always nice. When you can find problems that don't have solutions, you're in trouble. But there's some solutions here. They're actually very simple and cost effective. Matter of fact, they're free. The OSPI can gather the data that they were told to gather in 2008 and 2009. They can start gathering it, and I believe that's what they're trying to do. But they need to gather that for 3 years so that they know what the data really is before they act on it, because they should be acting on information rather than what they make assumed and assumptions, as the report did. They need to monitor the STIs and the pregnancy rates where these programs are being used. They also need to survey the parents so that whatever legislation they do is going to be responsive to the diverse values and community standards within the communities across the state of Washington. Those parents that have children in the current programs need to have a voice. And then they need to evaluate programs from several perspectives so those communities can have the kind of program that they want, making sure that they're accurate, making sure that they're good information, but also making sure that they match the family values. And they need to have it so that they don't have to have these unfunded mandates. My recommendation is do not pass ESSB 5395, even if it has a new number. Don't pass it. There's not enough information to make it be legitimate to pass. If you want a more fully complete critique of the program that was done by the legislature, I'd be happy to have you contact me at 509-482-2868, and you can have that report. If you need a copy of this for any reason, let us know. Again, that same number, and we'll gladly send you this copy. We need you. This is your action item. We need you to contact your state legislators and let them know that the HRI report required by this health district impact did not say that they should mandate K-12 sex ed, and that you want them to not vote yes. We want you to do that, and then we want you to make sure that your children are not involved in something that's an experiment on your children without ever gathering enough data to know, and actually no plan for gathering data to find out if it's really working. Your children will be exposed to explicit information from a specific philosophical view that you may or may not agree with. So make sure you're doing something. Hold your child out, contact your legislator, get informed, get the report, be involved, be a good citizen. Thanks for your time.